we have all the critical C's. And so one is cases. You come to operate, you come to learn how to be expert surgeons, and our case numbers and our caseloads show that. The second is we have colleagues that are top-notch. The third is connections. So we as a faculty work very hard to assure that you're meeting the right people. Culture is the last thing and probably the most important thing.
When I came to interview here, you really got that sense of camaraderie between the residents and the faculty, and you could just honestly and genuinely tell everybody got along and liked each other.
I wanted to make sure that I would get training, be able to come out and kind of do what I wanted with my career, but also have an enjoyable time with attendings and residents and make friends for life.
We cover all the way from infants to the advanced elderly.
You have your bread and butter cases, the tonsillectomies, ear tubes, thyroids.
Everything from free flaps, anterior and lateral skull-base surgery, sleep medicine with the Inspire implant.
We cover the breadth of pediatric specialties, and so our residents get to participate across the sort of continuum of patient care.
So we kind of see it all.
We take 4 residents a year, and we have 4 different training sites that our residents rotate through. We rotate at University Hospitals Cleveland Medical Center, Rainbow Babies and Children's, the Lewis Stokes VA Medical Center, and Metro Health.
So with each of those sites, you really have a distinct patient population that you're dealing with. So you get a lot of diversity in the training exposure to different patients, but also a lot of diversity in how you're going to approach those patients.
We're very lucky to have physicians who are subspecialty trained in all the major disciplines within otolaryngology, and it makes the experience here second to none in the country in terms of completeness.
Watching a resident enter our program as a PGY1 is an amazing thing. They're coming with a lot of energy, a lot of fear, and a tremendous amount of expectation.
Yeah, so definitely coming out of med school, you're very nervous because it's the first time you're really responsible for another human being.
And when you first start out residency, it is definitely a big learning curve, but everybody here is very supportive and they help you along every step of the way.
Watching other residents go through their training, developing, learning the skill sets that you spend so much time trying to teach them is incredibly gratifying.
We really see them blossom into these very mature, clinically adept physicians.
Now it's kind of like the confidence level, it's a stark comparison compared to where I was day one. And I think that confidence also helps because now I have juniors who are on my service that I'm also trying to help them get that confidence and get to that level. So I couldn't have asked for a better place to train.